me just introduce to you our guest speaker for tonight. Dr. Herman doesn't even know that I was kind of looking at his work for over 10 years. And I was intrigued with the things that I saw and impressed and shocked, all of those things, because I saw so many things manifest for people who wanted their health back. And sometimes we will do some drastic things, extreme things, of course, to get our health back because we want it so bad, whether we've done right or wrong. But with extensive postgraduate studies in the field of neurology, endocrinology, and more, Dr. Herman assists countless individuals in regaining optimal health. His rapid health restoration system focuses on cell cleansing, tackling the root cause of diseases through epigenetics. And this advanced method has brought undeniable relief to patients dealing with conditions ranging from anxiety, depression, autoimmune diseases, some cancers, and more. Now, of course, we can't talk about these being cures for cancer, but what we can talk about, we can assist our bodies to get well by the things that we choose and the things that we do. So without further ado, I'd like to present to you and introduce to you Dr. Lonnie Herman.
Hello, thank you very much. That was a great introduction. I appreciate it. Hello, everybody on the call. Thank you for having me. Should I just get started with my outline?
Absolutely. Have your way.
So when it comes to different diseases of the body, cancer included, the research that I've done is even in alternative cancer type of, let's say, therapies for the person to help the person overcome the disease. Okay, so we're not treating any disease. We're looking for the causes, the root causes of the illness in the person. And we're looking for ways to help the person safely and effectively cleanse their tissues of disease-causing agents that allowed the disease to manifest in their body. So when we can find these different, which I'll talk about in just a few minutes, when we can find these different disease-causing agents, infections and toxins, excuse me, even electromagnetic field stresses as well, and that's like cell phones and cell phone towers, and there's more than that. But when we can actually get these out of people's bodies and out of their environment, the cell can regenerate itself. This body can actually extract the disease and literally expel it from the body. And we've seen that countless times with so many patients with different types of conditions. So when it comes to epigenetics, it's the understanding that I follow is, well, the gene theory has been proven false. A person can have a gene for, let's say, breast cancer gene and never develop breast cancer. Another person can have a breast cancer gene and develop breast cancer. But there's a lot of proof in the epigenetics research that shows that people can have genes that never, if we say, turn on. Okay, so what the scientists in epigenetic studies did was they took the human cell, they put it under a microscope, they took out the DNA, they took out the genetic code from the cell, and the cell did not behave any different. The cell did not become more diseased. It did not change. All the functions remained the same. They knew that the gene did not predict the outcome of that cell's health state. Okay. What they did find out is that emotions, when they presented negative emotions to the cell, literally, when they presented negative emotions to the cell started acting in a diseased manner. When they put toxins like mercury or lead or arsenic or pesticides or weed killer spray, and the list goes on, there's hundreds, thousands of toxins out there, really. But when they started putting toxins near the cell or on the cell, that's when the cell started acting in a diseased manner and presenting in a diseased state. Furthermore, they discovered that when they put infections near the cell or on the cell or in the cell, whether it's a virus, a fungus, a mold, a parasite, and or a bacteria, when they put these organisms near the cell that would harm the cell started acting and presenting in a diseased state. There are countless studies that have been done on water and the water's ability to hold the energy of a thought, hold the energy of a spoken word. And you can look up, if you all want to write down, there was a scientist, he passed away already. His name was Dr. Masaru Emoto. What Dr. Emoto was able to prove over and over again was he was able to prove that emotions would trigger a diseased state in water. And you look him up online, if you just go using Google search Dr. Emoto water studies, Dr. Emoto, Emoto, water studies, you'll see, and click on images in the Google search area, and you will see images of the same water molecule when it was spoken, when the word love was spoken to the water, when peace was spoken to the water, when angel was spoken to the water. Those positive statements produce beautiful positive images in the water. What do we mean by an image? Literally, he took the water, let's say it was a cup of tap water, took a little bit of that tap water into another saucer or bowl, and he spoke the word love to it. And he flash froze that water, put it under a microscope, and looked at the water structure under the microscope. And the word love literally had the most beautiful, what's the word, snowflake type of appearance. Every time he used the word love with a water study, over years he did this, it always came out identical in its snowflake type of beautiful structure that it presented. Identical every time. When he spoke the word angel to the water, every time, and I'm not just talking in one day, I'm talking of over years of doing these studies, angel produced a halo type of snowflake appearance in the water under the microscope. When he spoke the word peace and other nice, calming, positive words, they all looked beautiful. When he said to the water, I hate you, the water turned into a very dark, the same exact water that love looked beautiful. The water turned into a very muddy, disgusting looking appearance. When he said to the water, evil, any negative word therefore, but evil, it looked disgusting. The same water that in one study looked beautiful turned into a diseased looking state, that water. And when we can understand, and I will get to more about the emotion studies and the emotion work that I do in a few minutes, but when we can understand that the water, our body, our body is about 80, let's say it's 85%, 80% water. We need to hydrate every single cell in our body from head to toe. We need to keep drinking water in order to hydrate our body because every single cell in our body needs water to live. And from your skin to your mammary glands, to your thyroid, to your heart, all your muscles, all your bones, your bone marrow, the stem cells that produce your blood, your spleen that's supposed to help you actually rid cancer, your liver, your organs, all of your muscles, all your lymphatic tissues have water absorbed into them in order to give them life, in addition to oxygen, of course. But the water, when we have negative emotions, when you look at Dr. Emoto's work, when we have negative emotions that have been ingrained into our being, into every fiber of our being, whether it was as a child, somebody was physically abused, or as a child, somebody was emotionally abused, or as a child, unfortunately, evil in the world. What about a child who was molested by a parent or an uncle or a neighbor or something? Unfortunately, has happened to some people. What about negative emotions that have occurred in abusive relationships? Or a negative emotion that somebody's holding and they couldn't save a parent who died of a terrible disease and they keep it inside. And even though they've been to psychiatrists or psychologists, or they've been to therapy groups, or they've been to motivational seminars, or read lots of books, or done meditation, what I've discovered with people is that these negative emotions have never disappeared from their body. They don't forgive. They don't, and a lot of people don't love themselves. They don't like themselves. A lot of people really don't truly believe that they can heal from the disease. So we're going to come back to this emotion discussion in just a little bit here in this discussion I have with you. So emotions are part of it. They create disease state in the body. And I will come back to that on a much deeper level in a few minutes. Another topic of discussion about what causes disease, including cancer, including autoimmune disease, including arthritis, including heart disease, including skin rashes and respiratory illness, and the list goes on of diseases that are diagnosed out there that people suffer from, is dental work. And the dental work is a big connection to disease in the body. Number one, root canals are part of disease of the whole entire body. There's a lot of research in cancer by doctors who are doing work outside of the main medical industry, is that root canals are linked to cancer development. So when we think of the root canal as a dead tooth in a living body, we think of that root canal as a negative energy in a positive life body, because the tooth is dead and the tooth has infections in it. They can never sterilize the root canal tooth. So that energy of that root canal, and we'll get more into this in a few minutes, but that energy of the root canal travels to different parts of the body. Literally, it can migrate to different parts of the body, the dead negative energy, as well as the infections that are in that tooth still, even for many years down the road. On my website, there is a link, which maybe we can put up after. I'll ask if we can actually share some of these links for this podcast, or maybe I can present to the hostess here and share with all of you links to my page. Maybe she can email you. But the thing is, on my website, and I've taken over 10 years of research that I put into this dental page on my website about different teeth that we've seen that looked healthy on a dental examination. They looked healthy on an x-ray. But when we actually tested the tooth, it was infected and it was hurting the person and connected to their breast cancer, or connected to bone cancer, or connected to brain cancer, or connected to their lupus, or connected to cysts that formed in the breast, or connected to a prostate problem or a stomach problem or heart disease. And there's more different diseases that I work with, but the teeth can actually have infections inside. There's many pictures that I show on my dental page on my website where actually we had to crack the tooth open once it was extracted, and they were black inside. Black is not the color of the inside of a tooth when the tooth is healthy. Black is when there's mold and infections like bacteria that are growing inside the tooth. And it's connected to blood vessels, connected to nerves, and every single tooth with blood vessels and nerves are connected to your entire nervous system and cardiovascular system. So these infections from the teeth can spread to different parts of your body. The dental work, in addition to root canals, and we'll come back to that point in just a moment about root canals, but the other thing is people can have constant abscesses and even what's called cavitations. Abscesses are areas of infection in the jaw where there's still teeth in the jaw. So somebody can have a tooth that doesn't hurt, feels fine, there's no throbbing, there's no bleeding, but right around the root of that particular tooth, there's infected bone because it's an abscess, because it's infected bone that's eating away at the jawbone, just like termites in the wood of the walls of someone's home. So what happens when these infections eat away like termites do at wood? What happens when these infections are eating away at the bone and the interior part of a tooth? Again, these teeth and jawbone, they're connected with blood vessels that go to your carotid artery. They go to arteries in the back of your neck, spine. They go to your stomach. They go to your heart. They go to your brain. They go to your breast. They go to your lymph. They go to your lymph nodes. They go all around the body. These blood vessels, they're all connected to the teeth, to the whole body. You can look up online. I'll come right back to these abscesses in just a moment. You can look up a dental, or excuse me, a meridian, MERIDIAN, meridian dental chart. And what German dentists back in the 1950s discovered is that all the teeth are connected to blood vessels and nerves, like I've already said, and all these blood vessels and nerves connecting the teeth to various organs in the body, various parts of the brain and the bones and the lymph and the skin. So it's very common that when somebody has an infection in, let's say, their lower front tooth, it can go right down to, let's say, and I don't have that chart memorized, it's not that important right now, but the tooth can be infecting the breast. So if there's a silent abscess that's in the mouth, it can be draining from the tooth right down to the breast, or right down to a heart valve, causing disease in the heart, for example. So we've got to understand about abscesses. The other term I mentioned a few minutes ago is cavitations. Cavitations are areas of infection, infected bone, that is, of the jaw, where a tooth was previously extracted. There are many patients, when I've done my unique type of dental examination on them and sent them out because I had concern about areas of the jaw that I felt were diseasing them and connected to the disease of parts of their body, whether it's breast cancer or prostate cancer, or it's a heart disease, or anywhere in the body, therefore, of any disease. I sent them out for a CT scan with a dentist who I have aligned myself with, who's got a CT scan machine in his dental office. And the CT scan revealed, more than an x-ray can, a CT scan revealed that there was infected bone, and the person had no pain. There was zero symptom. But the bone infection occurred, let's say, where wisdom teeth were taken out 40 or 50 years ago. Incredible. So we've got to look for these abscesses. We've got to look for these cavitations that appear in the mouth, because if these go unchecked and untreated with a dental procedure that has to be done, if they go unchecked and untreated, these infections that can be silent, literally killers of the body, taking life away from the person, because the bacteria that get into these areas that decay the bone, the bacteria, the mold, the fungus, the virus, the parasites, they get in there They actually migrate just like ants walk out of an ant pile to go and get food in the sidewalk, right? For example, if you can picture that, these bugs, they migrate through blood vessels to parts of the body and disease those parts of the body. So even in cancers, there are findings, of infections that are in the body. So when we have infections that persist in the body, these infections that go unchecked and untreated, these infections will interfere with our body's ability, our immune system's ability to be able to kill and clear certain disease of the body. Does that make sense? So your lymphatic system can be infected. Your spleen can be infected. The spleen organ is actually a cancer remover. That's what it's supposed to be used for. But when the spleen has constant infections that are growing in it, when the spleen has toxins that are in it, it's very difficult for the spleen to do its job that it's intended to do. So again, the teeth, root canals are harmful to our health. These abscesses or cavitations are harmful to our health. There's also challenges that people have where teeth were broken and repaired by a dentist. These teeth usually are infected, and dentists often miss the infections in them, adding to disease state of the body. And furthermore, fillings like these dental amalgam fillings. Some of you may know about that topic already, some may not. But there's a lot of proof that mercury is a poison for the body, that mercury filling or fillings in your mouth can actually be seriously harming you, because if those mercury fillings the research has proven that the mercury vapors of these mercury teeth are traveling literally to different organs in the body. Mercury is a very toxic, cancer-causing substance. So having those fillings in your mouth is not adding to your health, it is taking away from your health. Even though a patient can get on the topics I mentioned, can get a root canal extracted, the root canal, the energy, the dead negative energy, the infected negative dead energy of that root canal that migrated to your thyroid, that migrated to your kidney or your left breast or both right and left breast. When they pull the tooth from your mouth, it doesn't leave the breast. It doesn't leave the spleen. It doesn't leave the thyroid. It doesn't leave your lymph system. What I've discovered is that I actually get those teeth from a dentist. I get the tooth that was extracted, that was diseased. I get that tooth, and you don't have to pull all of your teeth. That's not the point here. But if we find a tooth that's really diseasing you and we are able to get it extracted, I'm able to find that tooth in a part of your body with my unique method. I'm able to find that tooth in the spleen or in the breast, and we can provide safe and highly effective, natural, holistic remedies. We'll also call them quantum energized formulas that will, using the principle of like cures like. We're not curing anything, but that's the idea, like in homeopathy, using the same energy of the diseased state of the body, we can make an identical copy of that energy, provide that to the person. And when that disease state energy that we're putting into that remedy, when that disease state energy moves to, let's say your thyroid, we can actually make the same energy of that disease state. When you take that remedy, it's going to neutralize it. Like cures like is the idea. So if we can think of, we'll get back to, let me stay on the dental topic, but frequencies are what it's all about. Because when you can match the disease frequency, the disease state of the organ, match it with a remedy, like cures like, it will leave. Okay. And I'll come to any questions. I'm going to go through this, but any questions the hostess will share with me. I see some questions coming up here. So, but I'm going to stay in my discussion right now to get through all this. I have a list of things I want to discuss, and then I'll answer whatever questions. So furthermore, the other topic about dental work that we've got to be concerned about is the injections that they put in your mouth. Now, I'm not saying to not get an injection if they got a drill in a tooth or pull a tooth or put a crown on the tooth, which, by the way, crowns usually are harboring infections underneath that are diseasing the body. But the local anesthetic that they pump into your mouth to numb your mouth, you think about this for a moment. Any of you who are listening to this who have been in the dental chair, who've had your mouth numbed, whether it was many years ago or just a week ago, think of a few hours after your dental procedure is over and the numbness wears off. Where did that numbness chemical go? How did it disappear? Did it just leave into thin air? Basically, did it just evaporate from your body? Or did it actually move from your mouth? Did it actually move from your mouth over to, let's say, your lymph system? And who says that your lymph system is strong enough to get rid of the dental anesthetic? What makes you think it is on its own? What makes you think it is on its own? And you need your lymph to be very strong to help your body counter the cancer that's growing inside. What happens when the anesthetic is actually moved into your bone marrow and it stays there? Like a tattoo ink stays in skin. It might fade a little bit. Maybe your body has some ability to detox some of these anesthesia chemicals. And not just dental anesthetics that I find in people, surgical anesthetics, sedatives, antibiotic residues, and other things, fentanyl and other things. When these different toxins are absorbed into tissues of the human body, and I'll prove my point in a moment with a certain study that was done in 2005. But when these toxins absorb into certain tissues of the body, they disease the organ, they disease the lymph, they disease the bone, they disease the organ, they disease the muscle, they disease the thyroid and other tissues, the breast tissue. And so even epidurals, women who've given birth to a child where they had the epidural injection in them, that epidural never left the body. It's absorbed into certain tissues. Okay, so back to the dental discussion, we've got to do a very thorough dental evaluation because these teeth can literally be connected to the disease state of your body. And so some people have gone through treatments where they've actually seen gratefully, the cancer disappear. And that's great. Whether it was using medical services, chemo, radiation, and surgery, and if they did and they are cancer free, seemingly, that's great. Congratulations to them. Some people have gone through chemo treatments and radiation treatments and surgery where they don't see the cancer, let's say, or they went in remission, which doesn't mean cured, but they went in remission because the cancer is not growing over a 6-month period or a 5-year period. But the problem is that what caused the cancer in the first place has never left the body. So we've got to do a very thorough dental evaluation with a person, because if any of those teeth are contributing to the disease in the breast or any other part of the body, it's very important to find it and stop it. Now, I'm going to mention 2 different bits of research right now. One of is a study that was done in 2005 by the American Red Cross, who teamed up with a group called Environmental Working Group. You can look up if you want, take a note, EWG, Environmental Working Group, The Body Burden, 2005. You can look that up online. That's actually on, I have that link to that research paper. It's on my environmental stressor page on my website, where I show a lot of different toxins that I'm able to find in people, that I find in people that they never knew existed in them, that are causing disease of the body. And we're able to literally make an identical frequency copy remedy of that toxin and get it out of the body. And I want to side note, we'll come back to that body burden study in just a moment. But the other thing is that for people who have actually used chemo in their past or present, there are certain harmful side effects that can happen to the body from that, like nerve pain disorders or numbness, right? You can have a neuropathy that developed, or maybe you have headaches, or maybe it's fatigue, or maybe your brain fog happened. The thing is, the chemochemicals, your body's never, and I'm going to prove it, my point again with body burden study in a moment, but the body's not been able to remove all these toxins on its own. So when we can find those chemochemicals, if they used it and they got cancer-free, that's wonderful. But when we can find the chemochemicals and help the body literally rapidly evacuate its tissues of these different chemochemicals, the body will only get stronger. Okay. So that's possible with this work that I'm doing. Now, back to the body burden study. And we have several other topics that we're going to talk about after this dental discussion. But the body burden study, what they did was a double-blind random study. And the double-blind random study means they just like put a blindfold on. They just chose different cities and different states and different hospitals in this country, United States. They went to these hospitals in different cities, different states, and they performed certain studies on newborn infants. And these newborn infants, it didn't matter about their gender. It did not matter about the race. It did not matter about the religion. It did not matter about social status. It didn't matter about anything. It was just a total double-blind random study. And they took biopsies of these babies' tissues right there at birth. The babies were still attached to the mother's umbilical cord. They had not been given a vaccine yet. And the babies, one of the rules of the study was the babies had to be seemingly healthy at birth. They were not, there was no Down syndrome. There was no missing limb. There was no thrush. There was nothing wrong with these babies, seemingly, right? They seem to be healthy at birth, still attached to the cord again. So again, any city, any state, any hospital across the US, any gender, race, or religion, social status, didn't matter. Just no vaccine and no illness. They found in the studies of the biopsies of these babies that there were 287 toxic cancer-causing chemicals in these babies at birth. They found plastic, they found styrofoam, they found birth control pill residues, they found lead, arsenic, mercury, they found chlorine, they found fluoride, they found residues of different types of antibiotics in these babies, and they were not given antibiotics yet. They found surgical chemicals in these babies. They found dental anesthesia chemicals in these babies. And these babies seemingly healthy. They found pesticides. They found weed killer spray. They found diesel fuel from jet engines in these babies. I haven't even mentioned 287 toxic cancer-causing chemicals are in these babies just born, just came out of the mother. They found when they tested the babies, mother's blood, the umbilical cord blood, they found the identical toxic chemicals, cancer-causing chemicals. They found the exact same thing in the mother's bloodstream. DDT insecticide. Even a mother who is, let's say 20 years old, who had never had food with DDT because they stopped spraying DDT in the United States, supposedly. They stopped spraying it, what was the early 70s, I think it was. They still found DDT in mothers who just gave birth in the 2005 study. So just understand, the body's already born with a burden, and now we add more to it. One way we add to the burden is there's chemicals from vaccines that are put in. I'm not here to say vax or anti-vax is not my point right now. I'm just letting you know that there are more toxins that are commonly pumped into babies on top of the burden that they already have. And then even though breast milk is probably better, I'm not saying it is or isn't, I'm going to make a point in just a moment. It's probably better than having a formula, but understand there are some babies who are allergic to the mother's breast milk. And I have found in babies who I've had the chance of working with, where they have eczema or they have developmental disorders of their brain, or they have different types of conditions in their body, juvenile arthritis. But let's go to babies who parents have brought them to my clinic, and they're being breastfed. I tested the breast milk and found candida fungus in the breast milk. I found epidural chemicals in the breast milk. The breast tissue is let's just say that it's sort of a reservoir where the body can store certain toxins. And that's not what we want to happen, but that's just the way that it is. Because what the body burden study proved is that babies were born already toxic. And now as we come out, we take on more toxins from pesticides and weed killer spray. And we take, maybe the baby had ear infections or throat infections. They take antibiotics and more too. There's toxins in the water supply, there's toxins in the food, and the list goes on and on and on. GMO foods, and the list goes on and on and on of how we can become more contaminated with these different toxins. So understand, when you're born with a burden, like what they found in this 2005 study, and the lymphatic system is already overwhelmed, and the kidneys are already overwhelmed, and the liver is already overwhelmed with chemicals, and other parts of the body, the bone marrow and so on, we're already loaded with these. What makes you, anybody who's listening to this, and I mean no harm when I say this, but what makes you, just think about it, what makes you really believe that your detox systems are working up to speed just by being born, or just because you ate healthy food or had green juices or did enemas or had lymphatic drainage massage or did meditation? Unless you can actually test for these different tissues of your body and find and test for these different toxic cancer-causing chemicals, and I believe infections are part of the whole disease, if we can say, puzzle that we're looking to clear from the body. Unless you really know what levels you have, and there's a way to do it without certain blood tests or hair analysis. I used to do those types of laboratories many years ago and gave up on them because they were not as accurate as we needed to be. But with that said, if you don't know if you're already carrying around a massive burden in your body when you're born, and you're 20, 30, 40, 50, 60, 70 or so years old, How do you know? You've had surgeries and you've had epidural, or you've had whatever it is that's been pumped into you. How do you know that your body is really ready to clear itself out from disease? You just don't know. You don't know. We can find out for you with my work, but you speaking in general about people around the world, just don't realize that the body's burdened already. Okay. There was another book that I read, and we're going to come back to certain topics of my discussion about what I look for with people. But I want to mention there's a few different cancer books that I read early on when I started taking alternative cancer courses. Alternative, let's just say we can't call it therapy or treatment, but ways to help the body to get stronger so it can fight the disease better on its own. Okay, so it can actually, hopefully, because the body is your body is the only being, or the only thing. I don't like to use a simple term thing, but your body is the only one that can literally cure yourself of a disease. I don't have that power. No doctors have that power. Your body has the power, but your body can be trapped by different things that are holding it back. So dental work was one. Okay. The water structure, two, and we're not talking about a better water machine. I'll get into that in a few minutes. But three is just understanding about the connection to cancer development in the body and other diseases too, lupus, MS, thyroid disease. Again, the list goes on of different diseases. Just understand that there are certain things that have been proven out there. Okay. So back to my alternative cancer studies, there was a book called Cancer, A Second Opinion. And there was a German dentist out there in Germany, a German physician who was out there in Germany. He helped many people. I'm going to get back to the root canal discussion in just a moment, but he helped many people overcome or help them reverse their own cancers on their own after medicine did not provide them the relief from the disease. And one of the points that he made was pulling the root canals. He pulled the root canals always. The first thing that he did with the patients was pull the root canals, and not all of them, but a lot of them, the cancer disappeared on its own. And that's going back many years ago. I don't remember what years he was doing this work in Germany, but there's a lot of other cancer books out there that you could probably get your hands on and look into that. So now what we're going to talk about, I'm going to mention a few more topics, is foods that stress the body. There are fragrances that stress the body. And we're going to talk about, we're going to go deeper into the emotional states that people have. Okay. So foods, what I have discovered is that there are certain foods, and it's not just me discovering it. So I've had great mentors over the years, one of many was a biochemist who mentioned something to me many years ago. I'm like 11, 12 years ago, 13 years ago, somewhere back there. He had told me that it wasn't the food that caused the person the disease or the symptom in the disease, like a rash or like hives or like joint pain with certain foods. Like people believe in gluten-free or dairy-free, and there's other things, other parts of the food discussion. But he said it wasn't the food that was causing the problem, because people were even having reactions to organic food. So it wasn't just GMO corn or GMO grains or dairy. People are having reactions to many different things, whether it was an organic tomato, or they can have a reaction to a spice like black pepper, like salt, sugar. Sugar's not a spice, but you get the idea. So eggs, soy, but we can even go down the line and say maybe somebody's having a reaction to a banana, something organic banana. So just understand that foods are not really the cause of the problem, but what it does tell us when somebody's having a reaction to a certain food, noticeable or not noticeable to the patient reaction to the food, it's from infections that are in the body. Even vinegar can cause a problem, which I find in people, literally a lot of people, that apple cider vinegar is actually hurting them. I find cinnamon hurting them, garlic hurting them, salt, sugar, black pepper. And there's many different things, whether it's in the dairy section or in the grains section, even vegetables, fruits. There are many different things, not just nightshades. In addition to nightshades, people are having reactions to food. Some of these reactions, they had no idea. It's not like somebody had dairy and all of a sudden they can't breathe, or they had dairy and they broke out in hives and they know the dairy is a problem. There are people who are having certain reactions to foods that they had no idea. And we're able to test the body to find the different foods that are causing them a problem. We have to get them, at least advise them. Some people don't follow all instructions or directions, but the thing is, we've got to get them to avoid certain foods for a period of time. Now, what I find is that the when we can literally find the infection that's in the organ that made them sensitive to the food, we get rid of that infection or help the person get rid of that infection. I'll make an example in a moment. When they get rid of that infection, they don't have the reaction to the food anymore. I've had people who were having terrible reactions to glutens, and they were having reactions to eggs, or they were having reactions to salt. They were having reactions to corn. They were having reactions to tomatoes, reactions like they couldn't breathe, reactions like hives, reactions like diarrhea, reactions like vomiting, literally, reactions like terrible headaches, where their blood pressure would spike when they eat a certain food. When we found the infections that were in their body that actually drove the reaction to that food to take place, and we help the body get rid of that infection or series of infections in one organ or in multiple parts of the body at the same time, these infections spread around the body. When we help them literally evacuate the body to extract and expel these infections, to literally neutralize them, what happened is the reactions to the food stopped. They could eat that food again and have no more symptoms from that food. And that's quite fascinating. So I do have a page on my website all about my food work. I don't get into the greatest detail there because there are certain strategies that I just don't reveal because there are certain doctors who unless I'm training them, I don't want them to say that they do what I do, but we'll leave that for another time, that discussion. But I do a very thorough food exam. There are certain things that I discovered about doing food testing. One of which is that, which actually there was studies in neurology early on, maybe 12 years ago. My first neurology postgraduate study that I took was led by, in the neurology school I went to was Carrick, Carrick, Carrick Institute. And Dr. Carrick spoke in the first class that I took, and he told us about a patient who was in a coma in a hospital in Switzerland. And this patient, he was able to wake from the coma. I believe what he said. I had no reason to doubt it. I'd heard from other physicians that it was a true story that went and did grand rounds with him in the hospital when this occurred. So he said that he discovered in the neurological examination of the person in the coma that area of the brain that seemed to be, if we can say, asleep, the area of the brain was integrated with the person's tongue. So understand you have parts of your brain that help control and receive signals to many different parts of your body. In order for a woman's breast to be able to produce breast milk, the brain has to tell the breast to produce the breast milk. Okay. In order for the stomach to work, the brain is telling the stomach to work. In order for your colon to work, the brain is telling it what to do. So what he found is that when he was able to stimulate parts of the tongue with flavors like orange or like cinnamon on the tongue, it was enough of a stimulus on the tongue that carried signals up to a part of the brain up here. It woke that person's brain up and they came out of the coma by food stimulus on the tongue. Think about it. When a person's in a coma, they're not eating, they're not tasting anything, they're not swallowing, they're not talking, they're not drinking. They're fed through an IV to be kept alive. And it's great that medicine can do that, keep somebody alive when they're in the coma. But he was able to literally stimulate the tongue with flavors, and it woke the person out of the coma. It was enough to stimulate that part in the cortex of the brain, and it woke the person up. Incredible. Many years later, I never had a person come into my clinic in a coma, but many years later, I decided it just dawned on me one day, why don't I just see if somebody's stressed by a food? What if I can find that it's a part of the brain or an organ like the stomach that's stressed by that food, and provide them a safe and effective remedy that will help the person to neutralize the infection that's deeply embedded in the stomach or in the brain or wherever in the body or the breast that was tied to the food, right? Because somebody can have a hives reaction to a food, or have an acne breakout to a food, or they can have a stomach pain, for example, when they eat a certain food. They know they have to avoid that food because they'll get a rash, or they can't breathe, or something, or they get asthma, or something occurs. So if it can cause inflammation in a tissue, then it can be linked to a disease in the breast or a disease in another part of the body where cancer is formed. Okay, so we take certain foods and place them literally sterile wise, but we place it on the tongue, and the body shows me a certain reaction with a kinesiology, a muscle test. Okay, so we're able to see the reaction that happened to, let's say, the sugar. Sugar fuels cancer. I think you all know that. So what we try with sugar, and we see the body shows us a stressed state that wasn't there before we put the sugar on the tongue. So when we put the sugar on the tongue, the body shows a stress state. And I'm able to find with my system that let's say it's connected to the stresses because they're lymph. And what's in their lymph, there's weed killer spray. and there's dental anesthesia chemicals, and there's dental mercury, and there's arsenic, and there's lead, and there's chlorine, and there's fluoride, let's say, for example. So we know that we can actually help the body literally get rid of those chemicals from their lymph system. When we do that, when we provide the person these safe, effective remedies, and we test them with the sugar again, guess what? The sugar doesn't stress them anymore. It doesn't cause a reaction. And I'm just giving one brief example there, but I'm able to actually literally tell that what I'm doing is working because we can actually see the symptoms from the person that the person has, they disappear like they never existed. So foods are very important because if you're fueling the disease, it's not a good thing. Well, some people will say, well, Dr. Herman, I became a vegetarian. I don't do dairy. I don't do grains. I don't have anything else. I like juicing all the time. And I only do green juices. I'm staying away from carbohydrates because I know cancer loves sugar. Okay, great. Well, I'll say this, that what I discovered, it was about 3 or 4 years ago. I discovered, the saying, you are what you eat. I'm sure we've all heard that one. You are what you eat. So what would happen when you eat some dairy 6 months ago? You've had it for years. You had ice cream and you had cheesecake, and my mother makes the best, by the way, cheesecake or whatever dairy items that you've had for years. It became part of your body. When you eat food, your body breaks that food down and stores the protein and the fats and the carbohydrates and the minerals. It puts it into certain parts of your body in order to sustain life in the body. You are what you eat. The dairy became the tissue. So when the dairy became the tissue and it fueled, for example, let's say there's a mold, a black mold that's in the organ, the dairy is in there. It's like a tattoo ink goes into your skin. It stays. It never leaves. It might fade over a little time or a few years, but it never disappears from the skin unless you do something to get it out, like a laser procedure that they can actually burn out the ink from the skin. Well, the dairy became your organ. It became in the organ. So the organ has the energy of the dairy in it. And that energy of the dairy, let's say it was fueling a mold that was growing in that organ that got in there somehow. And there's different ways that molds and other things get into us and cause disease in our body. But when that dairy is still in there fueling it, you can go off certain foods. You can become a vegetarian. You can drink juices all the time. You can do restricted diets. But that food became you, and we have to find that food got into a certain part of your body, literally, and it fueled, let's say, a mold or a candida or a fungus or a virus or all of them at the same time. And then we have to counteract those infections that are in the organ with these safe and effective quantum energized formulas, or we can call them remedies. So that's what we do. Okay. So foods are very important. Fragrances, another topic. I discovered this it was probably about 1.5 years ago. And I discovered this by parents who I didn't realize the impact it was going to have, which I discovered more really in the past 3 or 4 months. But parents brought their child to me. He was 17 at the time, and he had dropped out of school. He dropped out of school when he was in 9th grade. The reason why he dropped out was because his brain would literally almost shut down. He literally could not think. He could not interact with people. He went from smiling and happy and engaged in discussion to just like he became like a zombie. I don't know how to say it another way. His brain would just literally shut down. He wasn't laying on the floor dead, but he could not communicate with people. He couldn't even understand people. He would just stare off into space like he was lost. And he had eczema and he had this brain problem. His whole entire life, he had this brain problem and the eczema. And he doesn't have the brain problem anymore. He doesn't have the eczema anymore. And he re-enrolled in school after a few years of quitting, taking that big break in school. They told me that the reaction, they knew it was because of fragrances. Perfumes bothered him. It would make his brain shut off. Cleaning chemicals like bleach or Windex or ammonia-based cleaners, they couldn't have any fragrances in the house. They could not have any fragrances in the house because too many of these fragrances made his brain literally, like, if we can say, shut down. He could not communicate. He was lost. And once he was fine, he'd go over to let's say he took like an Uber, his brain would just shut down because they had the air freshener in the vehicle. And it would take hours for his brain to, let's say, turn back on, if we can put it that way, to clear up. And so they told me that was the reason. So we did certain tests with him by having him smell perfumes and finding viruses in his brain, to have him smell bleach, to have him smell certain other natural fragrances that we used as air fresheners in our clinic. And we found that these different fragrances were actually bothering him because he had viruses, he had mold, he had bacteria that were actually in his brain that spiked, if we can say that, that really stressed his brain to such a point that it would make his brain almost stop working. And right now, it took 2 protocols with him doing the same kind of exam. He had so many different infections in his brain and in his body that made the eczema and made the brain condition happen. It's no more. There is no more eczema. It disappeared completely. A lifetime of eczema disappeared within like 5 months, 2 treatments with me that spanned over about a 5-month period. And his brain is clear and he's back in school. And I've got some incredible reviews written and by his father. They're just very grateful people. So back to the fragrances again. I introduced on that one where I was able to know by the patient's family telling me that the fragrances were a problem, and I didn't realize until many months later that fragrances were bothering everyone. It's not just bleach. It's not just smelling Windex or chemicals like that. I found many different things that people were using in their home actually were bothering them. Okay, so I won't get further into that discussion, but what I do find is that there are bugs in the body. There are heavy metals in the body that are making the person sensitive to these things. So there's Lyme disease bugs, candidas, molds, viruses that are in brain, that are in organs, that are diseasing the organ, whether it's causing endometriosis, whether it's causing arthritic pain, whether it's causing brain fog, whether it's causing a disease like a cancer to, let's say, fuel the development of the cancer in the body. So I'm going to pause on this fragrance discussion for just a moment, but I'll say some of the research that I looked at many years ago was based on frequency work with Dr. Royal Raymond Rife, R-A-F-E. I don't use the machine now. I had one and I sold it because the frequencies that we're able to put into the water, it's a lot better to take a remedy that will program your body to get rid of that disease than having to sit by a machine for hours or days or weeks and be like trapped in a room. So, but what Rife talked about, at least I believe from what I've read, is that viruses and fungus he found in his research in the early days, like 20s and 30s, he found that it was these infections that made the abnormal cells grow and to lead to various disease development, like cancer or like swollen tissues. Okay, so I followed that line of reasoning for a while, and getting back to the fragrances is that I found that the fragrances, getting back to the dental and the food, everything I've talked about so far, is that these infections harbor disease in the body. Okay, the infections harbor disease in the body. Would you rather get rid of viruses? Would you rather help your body neutralize those viruses that are weakening your immune system, weakening your immune system's ability to actually, hopefully on its own, defeat the cancer on its own? Would you rather get rid of the fungal infections that can contribute to cancer growth? Even if some doctors will say it doesn't contribute, fine. Would you rather have your body have to fight the fungal infections that are in it and take away from your strength, from your ability to help you to do your best ability to reverse a cancer on your own? Would you rather have the fungus there as another opponent, or would you rather not have the fungus there as an opponent? You'd probably be a lot stronger to help your body deal with the cancer on its own without viruses, without fungal infections. Would you rather have mold infections in your body that are facilitating the growth of disease in your body, or would you rather not have the mold to deal with? Would you rather get rid of the bacteria and the parasites and the other chemicals? There's a lot of proof. There's a lot of proof that pesticides are adding to cancer development. There's a lot of proof that weed killer spray does. There's a lot of proof that mercury does. There's a lot of proof that arsenic and other chemicals are adding to the disease state of the body, including but not limited to cancer. So would you rather begin on a very effective approach, what I do, to be able to clear these different infections and toxins from tissues so that you have a better chance on your own to fight the cancer? Now, there's something else that I do with a person when it comes to cancer, but I won't get into that right now. I just think that we're not treating a disease, but we're looking to help the person get stronger to literally help the body to evacuate or extract and expel the disease. But I do have testimonials with breast cancer where it disappeared, cysts in the breast that disappeared, and there's others. I'll just say that, but we're not in any way, nor ever do I say that we're treating a cancer. We are looking to help the body do its job better. And there are certain other strategies, again, that I won't get into right now, that can help the person literally to let's just say clean itself out. I'll put it that way. Another topic that I wanted to talk about with back to the emotions, how I started this discussion, is that I found that people have stresses from their past. People have stresses in their present. I found that people have a lack of self-love. People have a lack of, not everyone, people have a lack of self-like or self-appreciation. Sorry, excuse me. People have a lack of forgiveness for themselves. People have a lack of forgiveness for somebody who wronged them, even though they think that they did forgive. I find that those energies are deeply embedded in their tissues and add to the diseased state of the body in different parts of the body. I found also that people have a lack of belief that they actually can heal themselves. They don't believe it. There's a way to reverse these different lack of forgiveness or lack of self-love, lack of self-like, lack of belief in healing. There's a way to reverse it with the work that I've created. And there is a page on my website about my emotional examination process. Again, I don't get into the greatest detail, but I do show people with anxiety stopped with this work, depression stopped with this work. We've seen other disease, whether it's rheumatoid arthritis, heart disease. We've seen even a person with congestive heart failure that stopped with this work because I found that her heart disease started right after her mother had passed, and her mother wouldn't listen to her. Very smart, very sweet woman, but her mother wouldn't listen to her about what she could have done to help reduce the stress in her body, where the heart disease and the cancer and the diabetes was killing her. Mother passes, the woman harbored all this, like not resentment, but and kind of in a way resentment. But it was interesting that she didn't forgive herself for. She blamed herself that her mother wouldn't listen to her. She blamed herself that her mother couldn't live on. She blamed herself for not being able to put her foot down, so to speak, and help her mother really see the light of doing healthier things for herself. So I don't have that file in front of me to remember all the different points that I discovered with her, but in 2 protocols, the symptoms of the congestive heart failure disappeared that she was sick with for 14 years. That's pretty impressive. And emotions can drive many different states of ill health in the body. When I say many different states, I mean, maybe it's better to put it, whether it's arthritis or it's heart disease or it's cancer, negative energies. And going back to Dr. Emoto's work that I mentioned in the beginning about the water, love looked like a beautiful snowflake. Angel looked like a beautiful snowflake. Evil looked like a disgusting mud. The same water changed its structure by the emotion. And again, I brought up earlier that when we drink water, it goes to every part of the body. The bloodstream carries that water. The blood carries the water to the brain, to the skin, to the breast, to the organs, because they need to be hydrated. So when negative emotions, which has been proven with Dr. Emoto's work, when negative emotions, when somebody doesn't forgive, let's say their father was an abusive person, or the mother left home and left them stranded with the father, it can happen both ways. Or there was, unfortunately, somebody loved their little puppy and the puppy died when they were a little kid, and they were scarred terribly for many years into the future. We're able to find these different ill states emotion-wise and work with a person. And here's what I discovered. We're able to work with the person to remove the negative emotion from them, literally remove it. What I found is that these different emotions, whether it's not loving themselves, not liking themselves, not forgiving themselves, not believing in healing, whether it's also from our political, yes, the political, let's just say politicians and things that are going on in politics, whether it's from an ex-spouse, an ex-lover who wronged the person. What I discovered is that pictures of the person, audio, and even video of that person, if we're able to obtain, I've discovered that these different experiences have actually triggered dormant bugs that were once dormant in the brain and the body. Literally, these negative emotions that people experience that they thought they forgave or thought that they moved on, these things are deeply embedded. These emotions are deeply embedded in their cells. And what's been proven, because it proved in epigenetics, that they can actually create a disease state in the cell. They can actually turn on dormant bugs in the body that were once dormant. So a lack of forgiveness for somebody who, let's say, abused a person, or lack of forgiveness for them to allowing themselves to be abused. Not that they really wanted to, but sometimes people get stuck in bad relationships. These lack of their ability to get rid of the emotional state that they absorbed into their cells has actually triggered different bugs, dormant viruses, fungal infections, and others, bacteria, parasites, molds, that only cause the body to become more ill and allow a disease like a cancer to manifest. So it's very important when I do my emotional work that I'm able to actually find these different infections tied to the negative emotion, find these different infections, provide the body safe and effective remedies that's going to help the body neutralize these things. The body, we see these infections coming out. Literally, people report to me what they see coming out of their bodies with this work. It's very effective. And when we can clear up that negative emotion, which I'm able to retest the person in a visit in the future, we're able to actually see those negative emotions literally disappeared, and the person begins feeling better or has already felt much better by the time they come back into my clinic. We've seen, there's one study you can look at on my YouTube channel, because I don't talk about cancer on there or on my website, but there's a study you can see there's a woman, she had multiple cysts in her right and left breast. We see it with the ultrasound and the mammogram. And in 4 treatments, and she did nothing else, and she says it right on the camera, in 4 treatments with follow-up ultrasound and mammogram, all those cysts disappeared. They all disappeared. I won't get into what the protocol was. I do discuss it in the video that's on my YouTube channel, but it's really impressive. Disease state of the body can leave when we get rid of what's causing the disease state, and when we can actually help the body neutralize these different abnormal cells or invaders in the tissues of the body. We can actually literally help the body neutralize those. One of the other things that I've discovered with my work is people have been traumatized. Not everyone, but some people, some more than I originally thought when I discovered this step about 2-3 months ago. There are people who are traumatized by certain things around them, like they can't stand cockroaches. They can't stand rats. They don't like spiders. They don't like, somebody was traumatized by a dog who bit them, a dog that bit them when they were a kid. And there's other things. People are traumatized by, let's say they had a child, unfortunately, tragedy happens, and it's terrible, but maybe a child had died, their firstborn, something happened, unfortunately, and the child passed, whether it's because the child had cancer and died, or they were, maybe they were just like 16 and driving wrong and had a terrible car accident. These experiences traumatize a parent or a sister or brother and can lead to the development of the disease in the body. But even going back to what I said before, the rats and the cockroaches and other things like that, is that I find those experiences, I started showing pictures of these different kinds of organisms like a roach or a rat to people. And I see that the body is stressed by certain things. Not everybody, but certain people are stressed by cockroaches. They're stressed by rats. They're stressed by snakes. They're stressed by dogs. They're stressed by spiders. And there's more to it than that. But we find that they're stressed by them, and these different emotional states that they get in from looking at a cockroach, for example, has actually triggered disease in their body by triggering dormant bugs that seem to be, I'm assuming, once dormant, but started to ravage their body over the years of them living with these different stresses in their life, to things like being stressed by a cockroach, for example. Furthermore, there was one woman that we worked with the emotional work that I do, one of my patients who had a terrible pain disorder in her body, 52 different symptoms, not cancer, but 52 different symptoms. And we discovered one of the main reasons when her symptoms, like Lyme disease type symptoms, first started, it was when she gave birth to her first child. And she actually had the video of the childbirth. You don't see anything happening, but you could hear the noise in the room. They had a curtain up in front of her, between her and where she's, giving birth. But the baby, when they took the baby out of this mother, the screaming that the baby had, because they kept the baby away from the mother. And then she comes over and the mother's just looking stressed and crying in this video. And they then bring the baby over to the mother's chest, lay the baby down, the baby quiet immediately, stops crying. Mother's holding her. Then the nurse comes back and takes the baby away, and the baby screaming. And they kept the baby away from the mother. She only held the baby for, I don't know, it was like maybe 10, 20 seconds before they took her back away from her. And that traumatized this woman to such a degree that she's had these pain problems, these different symptoms, brain fog and stomach problems and digestive problems and fatigue problems and just pain all around the body. For years, she tried to find answers. When we discovered that it was the baby, that experience, and I'm glad she had the video because we were able to use that during the exam, we found the trauma of that experience causing infections to be in, I believe they caused it, to be in certain areas of the brain and the body. It was amazing. Once we followed that line of reasoning in the method in my examination and provided her a protocol for what I found, the different Lyme bugs causing her lymph and her muscles and her joints and her brain and so on to be so sick, she came back to me more than 70% better, 70% relief. She was sick for years, 70% relief from that one treatment. Pretty incredible. So I found, again, people are stressed by politics. Some people are stressed because of recently with the COVID thing and the masks, right? Some people have really been traumatized by what's been going on. Not everyone. Some people don't like Dr. Fauci. Some people don't like Donald Trump. Some people don't like Biden, whatever it is. I'm not getting political right now, but I've seen that even what's in the news that people are paying attention to are literally burdening their brain and their body and causing disease to manifest in their body. And there's a way that I figured out to figure that out. Okay. Back to what one more point, and then I'll be done with this discussion. Back to what Dr. Emoto discovered, that water can change, the water structure can change and make a cell become diseased. So if you look online and look at Dr. Emoto water studies and click on images and look at the picture of love or look at the picture of I hate you or evil, understand people talk to themselves all the time. Some people have very self-defeating conversations with themselves, which is very bad. Some people listen to negative music. Some people listen to negative news all the time. People are sometimes they're just bringing themselves down constantly because of the messages that they hear and that they read and that they want to believe in. But what he discovered is that the water structure changes into a diseased state. So think of you or anybody you know who's got a negative state in their mind, or they have negative experiences in life, and it makes the water turn from a beautiful appearance to a dirty, disease-looking appearance. What do you think happens when that water is absorbed that you drink to hydrate your breast tissue, for example? What do you think happens to that water structure if you're in a physically and or emotionally abusive relationship? What if you've had deeply embedded negative emotions from a childhood, a terrible experience? Maybe you were bullied in school. Maybe you were laughed at, or somebody you know, right? So what happens is that disease, that negative emotional state will change the structure of the water in the breast tissue. And when you can see that water can change in its structure and look like a disease state, what do you think happens to the breast tissue appearance? Does it look healthy, or will it also look in a diseased state? I'll take the latter. So I'm going to expand on this. What I discovered is that as you drink that water, and the water hydrates all your tissues, when you drink that water, you're actually swallowing saliva too, right? You realize that. Even if you're not drinking water or drinking tea or drinking soda or drinking something else, you're swallowing that saliva constantly throughout your day. Water eventually, I'll come back to saliva in a minute, water eventually goes to your bladder, right? You're going to have to urinate it. Some of it comes out in your fecal matter. Some of it comes out through sweat. Some of it comes out in your air. You know it does because when you're in the cold weather and you exhale, you'll see that steam come out of your mouth. That's because there's moisture in the air that's in your lungs. And that saliva is brought all around to different parts of your body. So we found that what I truly believe is that the saliva is embedded like water, hydrating in the brain, hydrating in your organs and your lymph and your breast and your everything. Okay. So when that water eventually will go down to your bladder, kidneys to bladder, and you have to go to the bathroom, some of that water is coming out. Your saliva also got embedded into that bladder, or I should say into the kidneys. And that's also what's going to be coming out in the urine. Think about this for a moment. When you can get your blood tested for glucose levels, you can get it tested for thyroid hormones, you can get it tested for testosterone, estrogen, progesterone. You can get it tested for herpes. You can get it tested for Epstein-Barr virus. You can get it tested for candida. You can get it tested for lead, for mercury. You can get your blood tested for cancer, right? There's cancer studies that can be done on the blood. Your blood has to go to a few places, many, but one of the places in your body is in your face, in the cheeks, and underneath your tongue. You have glands that make your saliva. So let's just say, for example, that blood goes to the gland to make your saliva, and that blood is carrying Epstein-Barr virus, or it's carrying influenza virus, or it's carrying a mold. That blood is going to deposit without knowing it, the blood doesn't have a brain, but the blood is going to be deposited into the glands in your face that make your saliva. So since the blood is going to help make that gland make the saliva, or give the gland a fuel to make your saliva, what's going to happen to the saliva's production? Do you think it's going to be with the mold that was in the blood, or do you think it's going to be with the influenza virus that's in the blood? Do you think that if cancer's in the blood, would the saliva be produced with the cancer? Can saliva be tested for cancer? Yes. Can urine be tested for cancer? Yeah. Can urine be tested for sugars? Can urine be tested for hormones? Can saliva be tested for hormones? Absolutely. Absolutely. So what I discovered is that we can actually use the saliva. We have a person give us a saliva sample. We have a person give us a urine sample. These fluids can carry so many different diseased properties in them. And when we can find with the urine and the saliva that it's the identical match of that negative energy, diseased energy that's in the breast, in the lymph node, in the brain, in an organ, in the bone, anywhere in the body, we can make an identical energy copy, frequency imprinted water of that urine and saliva that's got so many different toxins and infections, abnormal cells in those fluids. And we can now make the remedy to match the amount of that disease state that's carried in those fluids that went to the breast, and help the body knock it out of there on its own. Does that make sense? I won't elaborate more, but that's something else that we do, because those fluids are carrying the disease of the body. Hopefully that makes sense to you. So these remedies follow a principle of like homeopathy, of like cures like, and that is basically what we're doing. And people come to my clinic from all around the world and across this country and throughout Florida for different conditions. And we send them home with protocols that from everything that we found in the exam, whether it's a 2-month, 3, 4, 5, even 6-month protocol sometimes. And we help the body cleanse itself. We help the patient help his or her own body to cleanse itself from the disease state. And that's what this is all about. So I thank you for the time I got to present all that uninterrupted, but now I'll give it back to the hostess.
Thank you so much, Dr. Lonnie. Now, you do have quite a few questions, and I have Rosa who's kept track of those questions. So Rosa, I know I wrote down some of the names. There was a Karan who was first, and then Ron Battle. So if you have some of those questions, I think some may have been answered in what you shared, Dr. Lonnie, but one of them I know you have Karan's question, Rosa?
Yeah. Can you hear me pretty good, Audree?
Yes.
Okay. I'm trying to get to the very first one. Was that one Corinne's? Let's see.
K-A-R.
Let's see. Okay. Now, the very first one was Ron B. Okay. He said, which water is the best to drink, distilled or spring water?
Well, me personally, I do distilled. I'll tell you why in a moment, but distilled, and I put minerals back in because we don't want demineralized water. We need minerals in the water. It's healthy for the body. We need that. Just what I found, and even waters can be carrying lead and arsenic and viruses. So distillation gets rid of everything, takes it all out except for the H2O. So any virus, any mold toxin that's in the water, any mold, any fungus, any bacteria, any parasite, and any chemical that's in the water, like arsenic is in the water or lead is in the water, it's all removed with the distillation process. So we distill the water and we put minerals back in, and that's what I drink all the time. That's all I drink for the most part. Spring water, just understand that we're not going to the spring, but when you're buying bottled water, they found lead in bottled water, like even Whole Foods water. I'm not knocking Whole Foods. I'm just saying that they found in studies of the bottled water, in bottled, not plastic bottle, but literally glass bottle, they found lead in there. So the FDA allows it and says that it's an approved level. Well, how much of that small micro amount of approved lead does it take to build up in your body to make a disease of an organ happen, right? So spring water, if you've got to turn to that, you do, but water can be carrying, whether it's even with a filtered water in your home, it can be carrying germs that you don't realize, like mold toxins and maybe a virus. So they say, these filters say that they're going to get a lead or chlorine or mercury or something. But what about the other things that they're not even looking for? And this, I just woke up, this was like 3 years ago, I discovered this. I did distilled water like 20 years ago and I stopped it. I don't remember the reason back then, but anyway, when I realized I'm very focused about my work. It's always thinking I've always got to innovate because the only thing that matters to me is helping sick people get well. And so what we found is that the water that was carrying the toxin or infection, it was diseasing the organ. So when that water, spring water, can have plastic in it, spring water can have, let's say, a mold toxin in it, but it doesn't have any chlorine. Okay, it doesn't have any fluoride. Great. But what if it has a mold toxin in it that was not tested for? And that got absorbed into your kidneys over the years, and you kept drinking the same brand of water. And the mold toxin got into the kidneys, and it makes you have a kidney disease, makes you have a high blood pressure. So me personally, distilled with minerals, if that answers your question.
Okay. All right. I hope you guys jot that down, or as much information that you're getting from Dr. Herman while he's here. Okay, I'm going to go ahead and ask the next question here. And this one is going to be from Karen. Okay, she said, how do we know what to look for with no symptoms?
All I can say is you can try to run laboratories and I'll just say that I stopped doing these labs for a reason I'll get to in a moment, but you can try your best without my help. That is, without coming to my clinic. You can try to run hair analysis for heavy metals and minerals. You can run a urine analysis for heavy metals and minerals. There's faults in there, but it's still at least better than doing nothing. When it comes to finding out if you have a virus in your brain or if you have the epidural chemical in your breast milk, I don't know any laboratory out there that you can order to find if that's there. So I don't know of any laboratory you can order that's going to find if there's pesticides in your breast milk or breast tissue. So this work that I do is a very unique work where we're actually able to, with using principles in biophysics and quantum physics, we're able to actually find, in non-invasive, we're able to find any toxin, any infection in any part of the body and provide safe and effective help to get it out of there. So my best answer is you can try to run certain labs on yourself, or if you have a practitioner who's near you who's willing to explore running certain labs. But in the end, you're not going to find if the mercury's in the brain. You're not going to find if the anesthetic is still in your lymph. It really would take my work to find all that. That's the only way that I can tell you. That I'd have to work with you to be able to find things in you and help you facilitate the cleansing process. That's what I have to offer.
Okay. All right. The next one, this is from Vicky, and she says, if you already have an old root canal, how do you reverse its effects on you?
You can't. You have to get it extracted. And then what I found, and because I'll tell you, going back many years ago, when I first discovered about the teeth, way long time ago, there was a woman who was coming in my clinic, and I was still going through the neurology postgraduate studies and neurochemistry and immunology I took as well. There's more than what we've listed here of my studies. But there was a woman who had this tic disorder in her lip and her cheek and her neck. Painful. It was nonstop, constantly, like this pulsing muscle spasm that was going on in the side of her face and her neck. And one day she says, Dr. Herman, I've got a toothache. I won't make it to my next appointment. And I'm going to a dentist, and we'll see you after I'm done with the dentist. Okay, great. It was like 3 months later, she came back in my clinic and her tic disorder in her face disappeared. And she said, do you remember I told you I had a toothache? I said, yes. She says, when I went to the dentist, he found my tooth was infected. He pulled it and the tic disorder stopped in the chair. Whole painful face and neck disorder stopped right in there in the dental chair. So I said, well, it's time for me to learn about teeth and the connection to disease of the brain and the body. And then there were some books that I had that I started reading about the dental connection to diseases like cancer and autoimmune disease. And in these books, they were talking about get rid of, just have the root canal extracted. And so I started getting into the root canal extraction with dentists who were doing it for me with patients. And even though I saw that amazing experience that woman had by pulling that tooth, that the whole tic disorder in her face and her neck stopped, guess what? All these other disorders, cancers and so on, they didn't just disappear or reduce in their severity. So it took me years to figure out that I can get the tooth from the dentist and find it in the organ and make a remedy of it to rid it from the organ. And this works. If you want to try to rehabilitate a root canal tooth, if that's kind of what the question was asking me, Let me ask you this. Can you bring to life a dead animal? No. Can you bring back to life a person who has passed away years ago? The answer is no. Can you bring back to life a dead tooth? No, because they cut off the nerve supply and they cut off the blood vessels to the tooth. The tooth is dead and it's harboring infection. And there's so many studies that prove that the negative energy, like a magnet, positive and negative ends of magnets stick together. Negative to negative repels, positive to positive repels. So when you think of the dead, disconnected from blood, disconnected from nerve, it's a dead tooth. You can't rehabilitate a dead tooth. So when that tooth is there and it's part of the disease, you either overlook it and leave it there, or you get rid of it. And I know people don't want to get their teeth pulled because you're not going to grow another one. And there's more discussion that I can give. What do we do when there's an empty, missing tooth in the mouth? But just know that if you were dealing with a very serious illness, and whether you're not or you are, having a root canal in your mouth it's an anti-life thing that a dentist leaves in your mouth. It's negative energy. And when you think of magnets, negative to positive, the negative pulls on the positive, right? So that negative dead tooth is going to pull on the positive life force in the body. That's the way I look at it. And actually that viewpoint I read in that book, Cancer, A Second Opinion. I don't remember the doctor who wrote that, but Cancer, A Second Opinion, that's the viewpoint he had. It's like a negative magnet end pulling on the positive life from the body. So you can't rehab a dead thing. It's impossible.
Okay.
Somebody brought up about implants just now. If I could just add to that. So implants, I like dental implants. It's just that understand that when they're going to numb your mouth again with the anesthetic, and they're going to give you antibiotics, just know that those chemicals are toxic to your body. Antibiotic residues has been proven in the research that these antibiotics, residues of them, are left over, and the body has to deposit those residues somewhere. It can't get rid of all of it. So it could deposit it in your bone marrow, deposit it in your liver, for example, in your brain. And when those residues are deposited in these tissues of the body, because the body's overwhelmed already with so many toxins, what happens is the candida fungus that's part of our natural makeup. I'm not talking makeup on your face. I'm talking makeup in the body, right? Parts of the body have candida in them. The candida is actually fueled by the antibiotic residue. So when the candida is fueled by those residues, then the candida grows and it grows and it grows and multiplies, and it can now travel to different parts of your body. So back to the implants, I like them. We just have to clean out the antibiotic residues that are left over. We have to clean out the anesthesia chemicals, because let's just say you pull a root canal, and we're saying that that's the right thing to do because your breast cancer is linked to it. But now they pump the anesthesia chemical in your jaw to numb your mouth to be able to pull the tooth. That anesthesia chemical gets into your lymph nodes and your lymph, for example. How is your body going to be able to use your lymph to clean out on its own to clean out the cancer? So we've got to be able to go after that as well. But I do like implants, if that answers that question.
Okay. Well, guys, for the sake of time, we would love to go through each and every one of your questions, but I have one more for you, and then we've got to go on with our call. And of course, okay, Dr. Herman is going to leave all of the information for you so you can get in touch with him. So we're going to do one more with you, Dr. Herman. Now, are you familiar with original medicine and RTBI? What are your thoughts, if so?
What is that one called? Original medicine?
They said RT as in Tom, B as in boy, I.
I have to look that up.
RTBI.
I don't know that name, but give me a second, please, if I can look that up.
Or BTI.
Yeah, they put RTBI. So I don't know. Original medicine and
original medicine.
Yeah, that was my question.
Oh, Dr. Avita. Hi, how are you?
Hi.
I don't
know.
know.
It's RTBI and original medicine.
RTBI. I don't know it. No.
What does that stand for, Dr. Vita?
So it's Ream's biological ionization theory.
I don't know of it.
Okay.
I couldn't have an opinion. I don't know. I'm sorry.
Okay, no, that's fine.
Is there another question?
Okay, just one more here. We have here, this is from Alicia. Okay, and she's saying, are there any options for removing and replacing the crowns?
I'll just tell you, let me give you this I'll give you a deeper or maybe a clearer way of seeing it, because you're not probably not too familiar with, pulling off crowns and checking underneath. But if you wanted to buy, let's say you really loved like a 1969 Corvette and it was supposedly in mint condition, and you go and look at this car, you found it online, you go travel to another state, and the car is going to cost you $100,000 or whatever the number is. And you go and you look and you say, I love this car. Look how beautiful the paint is. It's shiny. The wheels are shiny. You look inside the windows. It looks like a great interior. Would you just buy it by looking at the car from the outside, or would you want to lift the hood, look at the engine, drive the car, start it up and drive the car? So understand that if you don't lift the hood, you can't see the engine. Okay. With my method of testing the tooth with the crown on it, whether it's a porcelain crown or it's one of those old crowns that's got metal only, like a gold crown or a steel, like a silver looking crown, or it's got the porcelain over the metal where you see a metal ring around the gum line of the tooth. Understand that I can tell with my method of testing the teeth, I can tell if there's infection underneath, mold or something underneath that crown. When the dentist takes off the crown, lifting the hood on that Corvette to see the engine, you can't see the engine with your eyes without lifting the hood. You have to pull up the hood to see the engine. So the point is, I've seen over and over and over again that when I tested and I found that there was infection underneath or even a mercury filling underneath, when the dentist took off the crown, it was just so obvious there. It was just right in front of their face. They could see it and show the patient what was living underneath that crown. So I don't know if it's extremely rare. I haven't tested 7 billion people on the planet, but the people who I've had the opportunity to work with in my clinic, who I've tested, it's almost every single time. The crown that's 20 years old, 30 years old, 10 years old, even one crown we found 5 years old, porcelain only. When they took off the crown upon my recommendation, it was black inside. It was black inside the canal. It was diseased, and it was part of her breast cancer, that woman. So I don't, unless it's a porcelain crown that they can take off. When it's a metal crown, they have to literally break the crown without damaging your tooth, but they've got to break the crown. So if you're looking at a crown that's 20 years old, 30 years old, 40 years old, or even 10 years old or so, it's highly likely that there's infection brewing underneath that you don't feel, you don't smell, you don't taste, you can't tell. So I don't, unless I test the person to see if the tooth really does have something wrong with it that maybe the dentist missed, I don't have a better answer for you. I really like everything with me with a patient has to be individualized. It's very difficult to just give one general statement for everything. It's always about the one individual in front of me, if that answers that question. So the only way that you could see under the crown is to take off the crown. You can't see under a crown with an x-ray because x-rays can't go through crowns. So when the crown is covering the tooth, it's impossible to see what's brewing underneath the tooth. There's a picture that I show on my dental page of my website where met this woman. She had bad thyroid disease and brain fog and body pain, fibromyalgia, Hashimoto's thyroid, and more. And I'll leave. This will be the final part of this answer. And thank you for your time or giving me the time. But she had terrible pains, terrible fatigue, terrible brain fog, and thyroid disease. And there was a tooth in her mouth that I told her, I said, there's something wrong with this tooth. It's diseasing part of your body. We went back and forth for a couple of days. And I said, look, either you're going to follow me or I can't work with you or help you because I think that tooth is a big part of it. And she finally reluctantly went to a dentist I sent her to, and he took off the crown, and you'll see the picture. It's right there on my dental page on my website. When he took off the crown, it looked like a black piece of broken charcoal underneath. She had no clue. Her dentist for years that she was seeing getting cleanings said just floss and clean and brush and come over for cleanings. The dentist had no idea. There was no bleeding. It didn't look like when they took an x-ray of her tooth, the root looked fine. The root looked fine. But when they took off the crown, it was no, I'm not exaggerating when I tell you this. It looked like a broken piece of charcoal underneath. The dentist pulled the tooth immediately. She came back to my clinic right after pulling the tooth, holding her mouth, just couldn't believe she was in shock. How the hell did you know that was there? How'd you know? It was so bad. She was grossed out. She had no clue because the crown covered the diseased tooth. It covered it. So, yeah, that's the reality.
Wow.
Yeah.
Wow.
Well, right, Audrey, you want to take it over?
Yeah. Thank you so much, Rosa, for getting those questions in order for us. And thank you, Dr. Lonnie. I'm going to close out with some comments and things. Actually, Dr. Bustle would have been speaking, but she's going to wait. She's going to be speaking in a couple of weeks. But all of this, as I would say, if we think about what the Bible tells us, that we perish for the lack of knowledge, and I'm sure you know that to be true, Doctor, that a lot of people are perishing for the lack of knowledge. And I hope that what was shared today was definitely a opportunity to find out there are some missing and hidden things from us that we are perishing from because we don't know what we don't know.